I'm truly excited to be here with you all. I'm AJ McMahon, and we are here to look at accurate information to empower children 12 and under primarily to overcome ADHD. Thank you for being here with the Power of Able Network. Much at stake. Yes, there's so much at stake when it comes to our kids, our precious loved ones, and we get a chance to explore this today. What I'd like for you to do is to imagine a steak. Have you ever encountered one? Maybe you have an image in your mind. Some of you may have pleasant images, some of you may not. When you think of steak, do you ever think about the liquid that might surround a steak, whether it's on a plate or from a package? Sometimes there can be this substance, this liquid that we are led to believe is blood. And I know that may not be pleasant, but let's look at the reality of steak, which I learned last year really has to do with the fact that the liquid around steak is not blood at all. The blood has been processed out long before it reaches the packaging or the plate. And what we're seeing is a combination of a protein, I believe it's called myoglobin, and water. No blood at all. Most of my life, I was led to believe that the liquid around steak was something other than what it really is. And I reacted to that in so many ways in the preparation, in my thoughts, and even sometimes how I felt about a steak. What about you? What have your experiences been with steak? Maybe this is not even something on your radar, but thank you for letting us look today at this opportunity we have to think because there is much at stake when it comes to the children that we get to serve and work with. And we're going to use this as a, an analogy today to look at a couple of situations that I've been faced with in the past week when it comes to children and the struggles that they're having. We know that children are having tremendous struggles with attention, with transitioning, with repetitive behaviors, with outbursts, with just getting ready for bed or the day or getting out of the house. And I was able to talk to a professional this past week and a parent. And here's what we discussed. Excuse me. Thanks for bearing with me for that. I wanted to be able to speak clearly to you today, and thanks for that interruption. So, when I talked to the professional, what the professional shared was they have a 4 year old that they're working with in school based counseling. How many of you have you either heard about, work with, or have a child who has experienced where the therapist is working with the child in the school? This therapist has worked with this child for about 6 months and is really wrestling with, I would say, the myth of inadequacy. The myth of inadequacy is because, regardless of how much the therapist has tried to understand the child and work with the child through natural methods, meaning empowering the child to look at what they can do to overcome the challenges, regardless of the great relationship they have and the wonderful talks, the child continues to have problems primarily in the classroom and at school. And one of the things the therapist mentioned, which is very common, is that when the child is in their office, they're not having these challenges. What's really going on here? The myth of inadequacy can make professionals feel like because they have not been able to figure out how to help this child overcome the difficulties, they must be lacking something, some type of information or method or technique or ability to communicate to the child in a way that will help the child understand and overcome. And that also, the last part, that it can be a myth in itself that oftentimes children are having these challenges because they lack some type of understanding or ability. And for parents, parents can feel inadequate as well to a degree because no matter what they've tried, just like I've titled my books, which is The Cry of Parents I've Heard, I've tried everything and nothing's worked. The inadequacy, as far as the professionals and the parents, is really a myth because it feels like the inadequacy lies with them. When the inadequacy lies with my field, the field of mental health, the field of counseling, the field of behavioral health, where we do not equip professionals or parents with the accurate information they need to empower their children to succeed. Let me give you some specific examples. So, specifically, we can talk about this child, and oftentimes there's all these explanations for why a child may perform in an office but have trouble in school or home. It can be that there's some type of polite way to say that the school is inadequate or the parents inadequate or the environment is inadequate to be able to empower that child. There can be myths around that the child has some type of uh, divergence, deficit, or deficiency that means that they are unable, they're unable to understand, they're unable to comprehend, they're unable to do what they need to do in these environments effectively. And that largely is not the case. Just because it's not happening doesn't mean they're unable. That's the myth that's going on. So what is going on? Why might a child perform or do well in this therapist's office but have such struggles on a continual basis at home and school? It is because when we get a chance to step back and understand a child, okay, we get to understand children from their perspective. We get to look at the realities of what's going on, that it's a protein and water we're dealing with, some natural factors, not what we've been told for so long is going on, such as with the steak. So when we look at this from a child's perspective, we get to understand that for a child, they are wrestling personally with areas of tension. That therapist's office may not be an area of tension for them. Why? Because they're in an environment where they are meeting with this pleasant person. They know cares about them. They're having these talks, they're playing games, they're kind of doing these things, and that's not really an area of tension. But you take the child and you put them in a school situation where now they are expected to focus on doing work, or they put them in a home perspective where they're challenged to do things that they really don't want to do. And that is the fact for a lot of children. When we look at things from their perspective, we get to understand that many children don't really care about school. And I'm just going to say that as a fact, as a reality. Why don't they? Because in their perspective, in their immediate short-term perspective, they're not thinking about the great benefits that school and education has to offer. They're thinking about the fact that they would much rather be doing other things. They would rather look out the window. They would rather get out of their seat, even if it means falling out of their seat. They'd rather throw a tantrum. Why is that? Why might make sense for the child? Well, let me ask you something. If you had to sit still in a chair, okay, for a while. Now put yourself in the shoes of a 4-year-old. Okay, maybe you have a 4-year-old. Maybe you've had. Maybe you will have. Maybe you've worked with. Maybe you can just imagine a 4-year-old. Put yourself in their shoes for a minute. Would you rather sit in a chair and focus on learning? Now, some of you would say, man, that would be great because you're education minded. But a lot of 4-year-olds would rather be in motion. And sometimes what they can do in motion is to get out of their seat. Sometimes they'd rather uh, throw a fit. And you say, well, that's because they can't help it. They have to be in motion because they have these attention deficits. When the reality is, it's a preference. Think about it from a 4-year-old's perspective. Would you rather sit, if you got the choice, if you said, hey, 4-year-old, I'm going to give you a choice. Would you rather sit still or be in motion? What do you think most would say? And even if the child knows that sometimes being in motion may not be the most appropriate thing, when they look at the results, children can weigh out the consequences, the pros and cons of a situation. That when they're throwing a fit, that might not be socially acceptable, but pros and cons wise for them, what's happening? They're in motion. They get to protest, let us know about their feelings. They get to not do their work or the things that they want to do. And then because adults are confused about what's really happening and how to be able to help them, there's not really a consistent accountability. Or even if there is an accountability, because a lot of parents will say, well, I do discipline my child. However, there's not a consistency where the cons of the behavior are outweighing the pros. So when a child, which these children, your children, the children you know, are intelligent, it's not a lack, it's not a deficiency. It is them making a calculated choice. Yes, I know it can sound crazy, so counterintuitive, but just think about it from a common sense perspective, a logic perspective. And that's what the world doesn't want us to tap into, just our being able to look at things from the perspective of a child, that when they think about it, hey, I get to throw a fit, let people know how I feel. I don't want to be here. I get out of my seat. I'm in motion. All this stuff happens. I don't have to do my work. The consequences, yeah, there's going to be something, but in the grand scheme, it's not really going to be that big a deal, because then I can even, cry and let people know, or just kind of explain that I can't do this and all these things are going wrong, and they feel sorry for me and I get out of it. These smart children are really realizing that these things work better for them than other things. That is what's happening. So professionals are told that these things, the myth is that we're told that these are functions of a child not being able, that children, healthy children, would want to do their work, sit still, follow directions. When we understand the natural factors, the true protein and water combination is that children often would rather be doing other things. And this gets into the inadequacy that parents can feel. Because let me talk about the parent that I was able to talk with this week, who has a 6-year-old child at home. And with this 6-year-old, the 6-year-old was diagnosed with autism, like so many children are, at a very young age, because largely because the child had verbal delays and some other behavioral aspects. This child was diagnosed with autism. And as the child has grown, the parents and I have had conversations, because when you really look at the child, there's a lot of questions around whether the diagnosis fits, because children can have delays. Doesn't mean they're autistic. They can have they can have repetitive behaviors. They can have trouble transitioning. They can have social challenges. And a lot of times it's children are lumped into these diagnostic categories that really doesn't mean that autistic children don't have these factors. They can, but these are not the primary characteristics of the neurological condition of autism. So oftentimes we're getting it wrong when it comes to children, and children can be diagnosed. So we're looking at them from a certain lens, just like for most of my life. And I don't know if you have, but have you ever looked at that steak and you thought you were seeing blood and you were reacting to that? Well, in my field, we're taught to look at children from this blood perspective, not from the normal natural water and protein perspective. And it shapes so much of how we react in my field. And what we don't get to do is help parents to be able to understand their child from a natural perspective. That children can have difficulties, they can have delays, they may have trouble transitioning or different things. But does that mean that there's an actual disorder going on, or could it be more natural? And let's talk about this particular child for a bit. So, what the parent has been told by professionals is that the child, because of their speech delays, they get frustrated, and a lot of their outbursts, their tantrums, their crying fits, their whining is a function of them not or having challenges or barriers when it comes to expressing themselves. So parents are told that's why a lot of these troubles are happening. Then they're told, for example, the child loves the tablet, having the tablet, looking at the tablet. They're told not to take the tablet because this is a sensory thing, that the child needs the tablet as a tool to self-soothe. So, and that's why if they take the tablet, the child is having more outbursts. And all these things have the appearance of wisdom, but that's not what's happening, people. When we get to understand children truly understand them. We get to look below the surface and obtain the accurate information. What is likely going on with this child? What is happening with children? Let's talk about it. One thing that I did with this parent that might be helpful, I asked the parent, okay, how often are you seeing your child just across the board in various situations, just having reactions or outbursts that are clearly triggered by just frustrations from their verbal challenges? And then I want you to ask yourself, how often are that is your child having these outbursts or frustrations or reactions that when you really look at the situation is connected to them either not getting what they want in some way, or trying to get out of what they want in some way. And when the parent and I explored various situations, the parent was able to say that they have seen their child skillfully when they're trying to get something they want, or or need something, they find a way to communicate. They have effective ways of communicating. That's not the frustration. But when they're seeing the reactions and the frustrations, that is almost always connected to a situation where they know their child has wanted something different, or wanted their way, or hasn't wanted to do something that they are expected to do. So this parent is dealing with their child having reactions and frustrations when they're told to brush their teeth, go to bed, sit there and eat their food without the tablet, when the tablet's being taken. Anytime, even when the child is given one thing for breakfast that they liked the day before, but they weren't asked, and they want the other thing. And pretty much every day they want the thing that they haven't just been given, even though it's something that they like, because children want and like their way. Yes, I know it can just seem like this counterintuitive, wild thing, but for many children that are struggling, they're intelligent, and they want life on their terms. They want things their way, and there's nothing wrong with them. That is a natural protein, that is a natural myoglobin, is a natural water, is a natural factor of many children. And we get to understand and empower them. How do we do that? How do we empower these children? It does come down from a personal and a professional perspective of understanding them and what they need. And what they need is not attention. Well, they do need attention, right? But people say, well, children are acting up for attention. Well, attention can be a secondary gain. They're not largely acting up for attention. They're largely acting up because this is the skillful way. Well, when I say acting up, let me clarify. That's a little too broad. What I mean is when they're having the trouble with transitions, or they're having the outbursts, or they're whining or crying, or they're supposed to pick up their room and they're flopping around and they're crying and saying they can't, or they even get to the point where they're having these emotional outbursts where they're banging their head or slamming their bodies or doing things that bring great concern. That a lot of this stems from the tension that the children have between what they're expected to do, what they need to do, what they ought to do, and what they want to do. And in children, that is a great tension. Now, ask yourself from the 6 year old's perspective. Okay, you're in the morning. Parents are trying to help them get ready. Do you think the 6 year old gladly wants to brush their teeth? Do you think the 6 year old wants to get dressed? Well, why? Because when they brush their teeth and get dressed, where are they going? They're going to school. And a lot of children would rather, if they could, if they had their way, they'd rather stay home. They'd rather be on the tablet. Would a child rather go to bed and just be still and compliant when they can cry and whine and the parents get sucked in and they get to stay up later, and all this energy and excitement for them is much more stimulating than doing what they're expected to do? When children face these areas of tension, they often react in a way to try to lessen the tension for them, which creates great tensions for us as parents and professionals. But for them, it actually lessens the tension, because when the child, they may have tension as far as the parents are upset. There's consequences for their actions. But when they weigh the pros and cons, the pros for them it's often greater than the cons. How do we flip this? We flip it in love. We flip it in love by being able to understand that we can lay a foundation as parents. And this is where it starts. Not because we're to blame, not because we're inadequate, but because the true key is in us understanding as parents that we are able. And how are we able? We're able to set the foundation. The foundation is for our children to understand that we're the loving authority. We've been given the privilege to guide them in our lives. And we're going to do that firmly, fairly, and effectively. And how do we do that? For most, it's starting with the foundation of our children understanding that they are expected to comply, to do what we tell them to do, and that they're expected to do that and to comply and ultimately get to the point where they can find great joy in it. The children don't find great joy in it at first, not because something's wrong with them, but they're used to getting their way and enjoying the privilege of that. And even if they're not getting their way, meaning parents will say, well, I don't give them their way, AJ. What are you talking about? They don't get what they want in the end. But the excitement, the hidden rewards, the ways that they get out of things that go along with the battle, the stimulation, the ability to protest and express how upset they are along the way, to kind of make you a little bit miserable because they're kind of miserable at having to do these things that they don't want to do. Those things for children are appealing. They're pros, they're hidden pros. And when we get to suck those out, take those out by being able to say, okay, I love you and I understand that you may not want to do this. You may not want to sit at the table for this 15 minutes and eat what's put before you. You may not want to brush your teeth. You may not want to go to bed. You may not want to give up your tablet. And it's not a sensory deficiency. It's just another layer of something that you don't want to give up. You would prefer. But however, when I communicate that it's time to do something, this is what we're going to do. And when we train our children accordingly to understand we are the loving authority that they must comply with specific expectations and firm and consistent accountability, they will struggle. They will fight. They will fight for the status quo. And what will happen with your consistency over months? Yes, let's just talk about the reality. It can take months of consistency that they will ultimately realize they can't get the hidden rewards anymore, that when they comply, things go better for them relationally, effectively, and behaviorally. And they know that that's really how things are supposed to be. And the more they lean into that, because you lean into the lovingly firm accountability for when you tell them to do something, do it. It lays a foundation for them to push their energy more into what they need to do versus what they want to do. And the more they do that, the more they recognize that things are better for them because they haven't been able to get the hidden rewards. They've had to put, well, not had to, but they've realized that really the best way, the only way to sort of get out of trouble, to get past these lovingly firm consequences, to have things better, is to put their energy into doing what they need to do. And they find, you know what? Hey, this is pretty good. This is better for me. And when they start to do that, they experience true joy because they've known all along that's what they need, but they never really had the empowerment to be able to get there. Okay. So this is you being their trainer, their guide, helping them build up their character, logic, strength, and you to do that in specific ways. Now, let me just break down as we wrap up this video today. Okay. Because for the great majority of you, laying this foundation of your child being able to understand in that moment what you tell them to do and to be able to do it without the fuss and all the things, that is the foundation. Now, the first thing that the first focus. Now let's just talk about three things. The first focus is that you communicate to your child, hey, when I tell you to do something, I expect you to do it. It is a behavior thing. They may cry, whine, other things that you have to deal with, but you're not necessarily trying to address or account for what some of those emotional reactions might be. What you're really accounting for is them responding to what you say. Things like being able to communicate to them to do something and them to do it right away, right? Not 10 times. Okay. So the first thing is making sure you communicate, hey, I expect you to, when I expect you to do something, you need to do it. from a behavior perspective. So even if you tell them to go brush their teeth and they're whining a little bit, but they are moving and they are doing it, that's what you're looking for, that behavioral response. Second thing is to be able to understand with your child that they can do it. So even though they and understand that it's not inability, it's or inadequacy, it's really comes down to motivation. And they rather be doing other things. So to be able to hold them accountable, to be able to say, I love you, I know you can do this, and I'm going to consistently hold you to this expectation that you will do what I tell you to do when you do it. And if you don't do it in a healthy way, meaning you do it without the whining and crying and just go ahead and do it, that basically I'm going to hold you accountable to that. Well, let me backtrack a little bit. Let me clean this up. All right. So one thing is, so we talked about the first thing. We're focusing first, right, on the behavioral thing. We want to clean up the emotional reactions later. So when you're focused on the behavioral thing, as long as they're moving, going to do it when you say in that reasonable time frame, right? That's the win. That's the first win. You can get to the cleaning up the emotions later. So with the second thing is if they're not moving, doing effectively, to you want to hold them accountable. So even if they're pausing too much or just getting so into their emotions that it's kind of really messing up the works, you want to hold them accountable to that expectation. Believe in them so they know that they're not going to be able to have these protests, get out of it, these hidden rewards, these ways of letting you know that they're going to drag their feet because that's not what's best for them. Third thing is we get the opportunity to do something that's um, truly revolutionary and empowering with our kids. What is that? We get to be wise in how we manage this. This parent I talked to, they said, AJ, it's a battle at bedtime. It's a battle to get off the tablet. It's a battle when they don't get the tablet. It's a battle at meals. It's a battle to put on their shoes. It's a battle in all these respects. It's a battle at school where the child is jumping around and having significant difficulties. In wisdom, the third thing, your wisdom, focus on the foundation of them respecting you as a loving authority, to do what you tell them when you tell them. In wisdom, don't try to fight all the different battles at once. Narrow it down to one or two specific areas, uh, largely starting at home. I know school is important. That's where you have the most tension, but we'll get to that. But in wisdom, focus on one area. It might be the meal, or it might be bedtime, or it might be brushing the teeth, and just communicate, hey, this is what I expect. This is how I expect you to do it. And then train them to do that according to your expectation. Other things, let go for now, in the sense that you'll come back to them later. Why is this important? Because what you're teaching, what you're training your child is, look, when I put my foot down or when I clearly communicate to you an expectation, that is how I expect it to be. You're training them even in one area, because the other areas you're just kind of muddling through, but you're not really putting your foot down. You're training them that when you put your foot down, you mean business. This is your expectation, and you're going to see it through to get them ultimately over the hump to understand that, hey, when my parent says this, they mean this. They're going to hold me accountable. They're not going to get away. The best thing for me ultimately is to comply, even though I'm going to have all kinds of troubles and tensions and try to get them off track. But ultimately, I'm going to give in to them, their loving authority, see that it's better for me, comply, have the joy that comes with my success, and realizing I can do it with their help and empowerment. And when I get there, this lays the foundation for everything else. Then you go on to the next thing, which is maybe the morning routine, or one aspect of it, or the meal. Ultimately, you lay some foundation at home where the child has this respect and this authority, and they know you mean business. Then you extrapolate it to a specific expectation at school. When you go to school, whenever it's appropriate, you will stay in your seat. If you get out of your seat when you're not supposed to, you will have consequences at home. continue to build on that foundation. So, three things keep in mind that we talked about this video, okay? To understand you're not inadequate, your child is not inadequate, that there can be so many myths when it comes to things like attention or sensory issues. But the bottom line, you get to be able to communicate to your child that one, I'm going to lay the foundation of respect and authority. Two, I'm going to empower my child to let them know I believe they're capable. So I'm going to hold them accountable on a consistent basis. Three, I'm going to use my wisdom to not fight every battle, but to pick one or two specific battles on the foundation of them understanding to and being trained to respect my authority, to put their energy in what they need to do, not what they want to do, and ultimately see the fruits and the benefits of joy, relational, social, emotional, academic growth that come from that. That is what our children need. That is what you can do. You have the power. So please embrace these videos, embrace resources that help you to tap into your power, your wisdom, not the myth of inadequacy. Thank you for being here today. Let me read this medical disclaimer as we wrap up. All right. Okay. Hold on. Let me get to it. All right. Okay. What we've talked about in these videos is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified health provider with any questions or concerns you may have. Never disregard professional medical advice because of something you have read or seen. But please work this out with your professionals or find the way with your wisdom. God bless you. Stay tuned, stay connected, stay involved, like and subscribe, and let's continue this journey. Take care.